Good evening, everyone. My name is Shanmas Chua Baldivia, and I am going to perform the oral medication. Definition: it is giving the medication to be swallowed through the mouth. Assessment: assess the appropriateness of the drug for the patient, review medical records, allergy assessment, and laboratory data that may influence the drug administration. Assess the patient's ability to swallow medication, verify patient's name, dose, route, and time of administration, assess the patient's knowledge of medication and procedure. If the medication may affect the patient's vital signs, assess them before administration. If the medication, if for pain relief, assess the patient's pain level before after administration. Objectives is to ensure the patient metabolizes medication without feeling of nausea and vomiting, to offer most common, easiest, and least expensive route of administering medication, to provide a sustained drug action and increased in absorption time. Equipment is medication in disposable cup or oral syringe, liquid, water, juice, etc. with straw if not contraindicated, medication cart or tray medication card. That is the equipment. General considerations: some liquid medication preparations, such as suspensions, require agitation to ensure even distribution of medication in the solution. Be familiar with the specific requirements of medication you are administering. Medications intended for sublingual absorption should be placed under the patient's tongue. Instruct the patient to allow the medication to dissolve completely. Reinforce the importance of not swallowing the medication tablet. Some oral medications are provided in powder forms. Verify the correct liquid to dissolve the medication in for administration. If the if the patient's level of consciousness is altered on his or her swallowing is impaired, check the physician to clarify the route of administration of alternative forms of medication. Tablet and capsules are given with water to prevent antagonism of chemical properties of the drug. Crush the pills or liquid may be mixed with a small quantity of bland food if not contraindicated to the patient's diet. Pediatric oral medication may be given by dropper method depending on the age. Let the medicine flow by cheeks to prevent danger of aspiration. If patient's intake is being measured, record the amount of fluid that was taken with the medicine. Drugs drugs that discolor the teeth or tend to damage enamel should be given well. Diluted should be taken care through a drinking straw. Reconstituted medicines, especially antibiotics, have to be stored in a refrigerator to maintain potencies. Soft food can be vehicle for pills, tablet, or capsule, especially for the person who find them difficult to swallow. Monitor reaction of the patient to the medication administered and document and procedure. Step 1. Gather equipment. Check medication order against the original physician's order according to agency policy. Um, Step 2 is know the action, special nursing consideration, and safe dose ranges, purpose of administration, and adverse effects of the medication administered. Step 3 is place medication or move the medication cart outside the patient's room or prepare for administration. 4 is transport medication to patient's bedside carefully and keep the medications in sight at all times. Step 5 is identify the patient by checking the name and the identification on the patient's identification band. Identifying the patient ensures the right patient receives the medication and helps prevent errors. Explain the procedure to the patient to gain cooperation and allay anxiety. Assist the patient to an upright or lateral position. Swallowing in facilitated proper positioning and upright side lying position protects the patient from aspiration. Administer medications, offer water or other permitted fluids with pills, capsules, tablets, and some liquid medications. Liquid facilitates swallowing of solid drugs. Some liquid drugs are intended to adhere the pharyngeal area, in which case liquid is not offered with medication. 9 is remain with the patient until each other medication is swallowed. Never leave medication at the patient's bedside unless the nurse has seen the patient swallow the drug. Perform the hand hygiene. Leave the patient in a comfortable position. Hand hygiene prevents spread of microorganisms. Check on the patient with 30 minutes or time appropriate for drugs to verify response to medication. This provides the opportunity for further documentation and additional assessment of effectiveness of pain relief and adverse effects of the medication. Recording and charting: 1. Date and time of administration. 2. Name of drug. 3. Dosage, amount and frequency. 4. Route of administration. Signature of nurse administering the drugs. Evaluation: patient is able to ingest and metabolize medication without feeling of nausea and vomiting. 2. Is patient emotionally accepts medication. 3. Decide the therapeutic effect is obtained. 4. Experience no adverse effects including allergy response, systemic effect, or injury.